Hi everyone, Sarah Burt from EarthWise today, wanting to talk about immune system. How do you know if your immune system is failing you? Do you know what the immune system symptoms will be if your immune system is not doing well? And why is it when you know your immune system is not doing well and you go to your GP, do they give you blood tests that you ask for and they come back saying nothing is flagged up, everything is normal, but you know because you're not fighting off infections as well as you could do, you have inflammation, you're getting food allergies, food sensitivities, you're developing hay fever and allergies to pollen and dust and other things like that, and there might be chronic inflammation starting in your body, which may be an indication of autoimmune starting to set up. So these are things that are really important, because what I realize in my practice is that people come to me time and time again with obvious symptoms of immune system failing, and when they come back with their blood tests, the ranges are saying that they are all completely normal. This leaves people feeling powerless to do anything else because they've been told it's all within the normal ranges, and this is not a good system that we are following. In my first talk that I did on immune system, I gave a lot of advice for general well-being. I gave advice on how the liver is affected, or the liver is very important in affecting how our immune system works. I gave examples of how the gastrointestinal tract is very important in affecting how our immune system works. 70% of our immune response is in our gut. Our liver is responsible for then, once the immune system has detected a pathogen, a bacteria or a virus in its system, the liver is responsible for exiting whatever it is. If the liver is backed up or bunged up or not working efficiently, it's not going to do that job properly. I gave examples as well as of how cortisol, high cortisol levels, can also really affect our immune system, because a high cortisol, i.e. high stress levels, can really depress the immune system. In this video, I gave examples of what can help the liver, what will help the gut, what will help the adrenal system. So go back to that video, refer to that for specific nutrients that will help these areas. But what I wanted to do today was actually illustrate how the immune system can be detected by these blood tests in being under functioning, and what it is you need to look for. Now, I'm not knocking the NHS. They do a great job at trying to get these basic ranges for us to be able to determine what our thyroid function is like, what our adrenal function is like, what our liver function is like, our white blood cells, our red blood cells, our vitamin D levels. And all of these are associated with immune function or normal basic healthy living. But the problem is that they take a mean average, a very high, broad average between the ages young adulthood to late adulthood. So they're not really as tight and considering the individual, the lifestyle factors that really are necessary. And the difference between the NHS ranges and what we would call functional blood test ranges is very, very different. So I wanted to go through those because I thought it would be quite interesting to empower people to be able to know exactly what's going on with their blood test results. So if your immune system is not doing well, you will go to the GP and you will ask for tests. They will test your thyroid function, and they will test for your TSH levels, and they will test for your T4 levels. The most important one, and I'm going to have to put on my glasses here to read this, is the T3 levels, because this is the best marker to show how active the thyroid hormones are. Without that range, really, we're not doing an accurate job. The NHS range for normal thyroid function is to determine that 4.5 millimoles per litre found in the blood is okay, whereas the functional optimal range is between 1 and 2.5. Below anything above 2.5, you're not catching thyroid dysfunction early enough. So it's really, really important to know that that range is out. The B12 levels, which again are very, very important with immune function, state here that Anything more than 190 millimoles per litre of blood is fine, whereas functional medicine would say no, it's got to be between 500 and 1000. That's a big difference, because normal low level ranges can lead to fatigue and neurological symptoms. That's why so many of us are walking around with not enough B12 in our bodies. Vitamin D is an interesting one, because this is imperative to hold up the immune system and make it work effectively. And what the NHS range here is saying is that anything up to 50 millimoles per litre is fine, whereas functional medicine is saying the optimal range is between 75 and 125 millimoles. So that's why one of the first things I recommend for people that I see in my clinic is to up their vitamin D intake. Ferritin levels, interestingly enough, the ferritin that is recommended by the NHS this is stored iron in the system. So are they saying that anything above 20 micrograms is a bit of a warning sign? But what we're saying is that no, actually you want to, especially as a menstruating woman, to have at least between 60 and 100 millimoles of ferritin stored there. Below this you will get breathless, you can get brain fog, you can get hair loss, and that's why so many menopausal women are experiencing hair loss in this time. So that's another one to really understand. Then we've got as well what I want to do is move on to the white blood cell count, because that's very important with the immune system. So the white blood cell count has got different white blood cells, and it's really important to understand this, because you get a general white blood cell count, which says here the NHS range is between 4 and 11 is fine. And actually what we're saying is that too high or too low would indicate that the immune is either suppressed or has an infection in it. So the functional medicine range is between 5 and 8, so not 4 and 11. It's very different. But you've got neutrophils, and the neutrophils will indicate, if high, that there is a bacterial infection in the body. The NHS says that anywhere around 2 to 7.5 is an indication of that, whereas the functional medicine is saying actually anything between 2.5 and 5.5 is a warning sign. So this is important with bacterial infections. Lymphocytes, which will show if they're low, viral suppression, but if they're high, they can show chronic activation. Really important, because for anything below 1.5 shows that it's low, and anything above 3.5 will show that it's high, as opposed to the NHS, which is 1 to 4. We then got if we have high eosinophils, higher than 3 means that you will have allergies and parasites and histamine issues, whereas the NHS says no, anything not higher than 5 is a worry. But you can see that the functional medicine brings it right down to earlier warning signs. We've got then monocytes as well, which can be elevated in chronic inflammation, and that again says that anything above 8, whereas the NHS says no, anything above 10 is fine. So these are very important and critical measurements. The liver as well will be a big sign to sort of show how our immune system is working. And of course the liver is going to be producing certain enzymes, and these are measured. And what I found with the blood test results is that, again, with the NHS ranges, they're saying it's fine until it's 40, or it's fine until it's 60, or it's fine until it's 7.5. And what, of course, the functional medical ranges are saying is no, that's gone way over and above, and now there is a problem. So ALT, which if it showed is raised, will show a fatty liver. So they say that a marker of 40 is fine, but we're saying no, 30 means that, and anything over 30 is not fine. AST can be raised with alcohol or medication use. Again, the NHS says anything over 40 is a problem, and again we're saying anything over 30 is a problem. You've got GGT, which again, they say 60 is fine. We're saying no, 40 is fine. And this can be really linked to how well your liver is detoxing. And then we've got C-reactive protein, CRP. It's saying that anything more than 5 will show perhaps chronic inflammation and autoimmune disease. And functional medicine is saying no, anything more than 1 is showing those problems. So this is just an example of how the blood test can be read correctly if you know what you're looking for. Too many people are having normal results come back when their immune systems are evidently not normal. The point of dealing with this is that so it doesn't go on to chronic immune problems. The sooner we get onto this, the better. And then we can use herbs like echinacea, astragalus, ashwagandha that are really, really fantastic at helping our immune systems. We can use the medicinal mushrooms. We can know how to supplement with vitamin D, with vitamin B12 and vitamin C as well. We can eat foods that are going to help bolster the immune system. All of these were in the previous video. I won't go over those again, but I just wanted to say beware your blood test results because they may be missing something. Hope that's helpful, guys. Any comments, drop them below. Very happy to answer those. Please don't forget to like if you like the videos, and see you next time. Bye bye.